The opioid crisis and the overdose. We all know about it, but this is how I found my patient dead on the bathroom floor in our ER. She was our second patient to die in 4 months from self-injecting opioids in her IV. So why us? We know this population and our patients are being harmed. We know the problem, but we lack the tools to fix it. Patients access their IV sites and it leads to prolonged hospitalizations, unexplained infections, stress on the hospital staff, and lead to fatal overdoses. The opioid epidemic continues to rage, and it's only exacerbated by COVID-19 and social unrest. The time to act is now. Current solutions include direct observation, which is costly, video surveillance, which we're unable to use outside of the room or in the bathrooms, or tamper detection devices, which don't prevent and can't be used with infusions. So why just detect when you can IV protect? We have the perfect solution. Protection at all access points. It allows infusions while in use, it has a universal customizable lock, a universal hospital key, it's MRI safe and reusable during the patient's stay. There is no comparison. IV Protect checks all the boxes. So there's approximately 150 million emergency department visits a year, with 25 million of those receiving IV opioids. This is our targeted market. We've already filed a provisional patent. We want to license this product and partner with an experienced medical supply manufacturer for production. IV Protect, better outcomes, it prevents self-injection leading to infection and overdose, saves money, continues protection without monitoring, and improves efficiency. It allows infusion therapy while the protective device is in place. Help us keep our vulnerable patients safe. Thank you.
Great job. All right, I'd like to invite the judges, the esteemed panel, to join me up here on stage and to ask a few questions for 3 minutes.
Hi, Kara. This is Marlon. Could you talk a little bit more about your market for this particular product and who you'll be focusing on?
Yes, initially I'd like to focus on the emergency department. That's an area that I'm experienced in and it's a market I know well. Just based on our current evaluation, in Florida alone last year, we saw almost 35,000 patients, and that's approximately 9,000 that would be benefiting from this IV lock there. Taking the 3 Mayo sites together, that's about 154,000 patients with 39,000 that would be marketable for this IV Protect device. That's our initial market, but we definitely see areas where we can expand where it's in hospital use and also with home health providers.
Chair, can you describe a little bit about the lock system on there? It seems like it's got a key, and you said it's a universal key?
Yes. We spent quite a bit of time. We have a universal locking device, but it can have up to 35 separate keys for this device. It works much like a TSA lock where the key actually customizes our lock system, and that allows one hospital to have one key system throughout the entire hospital. We have the keys RFID chipped, so they're locatable for in the hospital, and everybody in that hospital would be able to access that individual lock, but anybody outside the institution would not be able to access it.
Is there a system, so you said the were locatable, is there a system that identifies if a patient gets a hold of one of those keys?
Yes, they would all be traceable within the hospital system, and the keys are actually checked. Our intention is to have them checked out of the Pyxis, much in the same way that our pain pumps have worked for decades with the nurses, where they check the key out to access the pain pumps. We would have it in a similar situation, and also have keys accessible in our code carts and with the team leaders on every floor.
Oh, thank you.
Kara, interesting presentation. I was curious if you could clarify a little bit about where you are in terms of a pilot.
So we have everything done up to the 3D printing. We've done some discussions with our colleagues, including nurses and other providers. Right now, we have a couple of grant applications pending. We're at the point where we need the funding to make the provisional molds for a true prototype that we can go and test in our sim lab.
Can you speak a little bit to any validation you've done with other hospital systems, and in particular, what are people willing to pay for something like this?
Yeah, we've talked to several different groups. We actually have contacts throughout town. Nobody has a device like this. We can't find anything like it on the market. Once we are able to get our original molds done, this should be a very low cost. We're thinking most likely in the setup of what the initial INT hub would cost for the hospitals. And our goal is to get this, with it being a safety metric, that it would be a sanctioned reimbursable device by the insurance companies.